My name is Nabila Azib. I'm a plastic surgeon in Morocco, and I'm also the head of the Aesthetic Medicine Department at the ECAMS, European College of Aesthetic Medicine and Surgery. One of our main courses in the Aesthetic Medicine Department is the M21 course, called NSFT, Non-Surgical Facial Transformation. That means that we are taking into account the whole face. We are giving to our patients a full face transformations. We want the doctors to learn how to approach the face globally and not only with one area.
M21 is one of the most significant and important courses for those doctors that they want to go further on their practice.
This course is separated into two parts. One is theory, which is done online for the anatomy and the techniques, followed by a theoretical exam. And then we will meet with all the doctors and the faculty for 2 days. The first day will be the hands-on cadaver.
During the cadaveric dissection, we will teach you exactly where to inject in this right plane to be safe, and you will be able after to dissect and see exactly where you were and if you were right.
In this course you can have a different approach, different faculty, different technique, and we can share our trick to everyone.
On day 2 we will have a hands-on live models this time, so all the doctors can inject in a real live patients. They will learn how to assess and analyze the face for a full face transformation.
As well as teaching doctors how to inject safely, we're also concerned about how to select the patient assessment, because it's a milestone of a successful treatment, and according to race, gender, ethnicity.
Actually, I changed some approaches. I learned different techniques, and I do believe that in aesthetics and in medicine in general, you need to be always learning.
It was great because there were a lot of experts from all around the world just teaching us the different standards of beauty and how to achieve them and how to understand every patient and the anatomy of every patient.
So fabulous tips and tricks to take home that I'll be looking forward to implement back in Australia.
I was in a lot of training in aesthetic medicine, and here I found all the things that I wanted to find in the training. It is, in my opinion, the highest level of credibility institute that I can find.
So I've been to so many trainings before, but this particular training by all the experts, it's really an amazing experience. So I would like to recommend all of you out there who's learning to be a good injector, please do join ECAMS.
We gotta learn from different perspectives. We gotta learn from plastic surgeon, we can learn from aesthetic physician, and also we can learn from dermatologists. So we can see that every specialist, every doctor has different approach. So yeah, we can choose which method suits us.
I like the hands-on, the small groupings, and I like that I get to learn techniques not only from the mentors but from my colleagues.
The faculty is very competent, very didactic. You really learn from them, you really learn different techniques, you have their tips and tricks, which is super important.
Main focus for me, because I'm already an experienced injector, is to see the different approaches from all over the different trainers, and you have a broad base that you can transmit to your patients and treat every patient individually with like a great makeup artist set. So you can choose from all the different styles your own and mix it together, or treat like individual patients by the needed approach.
It's really a scientific and evidence-based educational session. This has been endorsed by multiple authorities, so I think this is a really great course worthwhile attending.
With the EChem course, we really learn a lot and definitely will apply it in our daily clinical works.
There was a time when we try out different things, push our limits to the injection skills and see how we end up. It was very interesting. I myself had a close shave with 2 blood vessels, and luckily it did not embolize it, and that gave me confidence of the injection skills and also give me confidence of the equipment I'm using.
And also having experience all the way from surgeons to cosmetic doctors and dermatologists too. And they've been really, really friendly. It's been great to network with them and to learn from my colleagues.
We look forward to see you
in our next course.